Namaskar dosto, good evening friends. I'm Dr. Sanjay Kalra, your friendly and familiar endocrinologist, trying to be fit as well. And welcome to Obesity Special MEDtalks with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 1057वां 1057th एपिसोड है. Let's have the headlines for today. Now, a new study commissioned by Lancet has revealed that 44 million women and 26 million men aged above 20 in India live with obesity. So 44 million या 4.4 करोड़ महिलाएं और 2.6 करोड़ पुरुष, they are obese. Researchers have discovered that not only can bacteria in the gut be associated with obesity, but there is a gender difference as well. वही बैक्टीरिया जो हैं वो पुरुषों में अलग बिहेव करते हैं और महिलाओं में अलग. Another study has found out that obesity can negatively influence sperm quality and male fertility. It disrupts reproductive health by changing the brain circuitry. तो जो हमारे दिमाग के प्रोसेसेस हैं, हार्मोन्स आपस में बात करते हैं, स्पर्मेटोजेनेसिस के लिए बात करते हैं हमारे हार्मोन्स, उन पे इम्पैक्ट पड़ता है ओबेसिटी का. Obesity is also a major cause of erectile dysfunction in young men and not so young men. And as far as death from obesity is concerned, men are at higher risk than women. तो उसी BMI के लिए, उसी वेट के लिए पुरुषों का ज्यादा चांस है गड़बड़ होने का डेथ में एज कम्पेयर टू वुमेन. अब इतनी सब गड़बड़ वाली अगर न्यूज है तो लेट्स सी व्हाट आवर टॉपिक फॉर टुडे इज. Obesity and men's health, something we really need to speak about and something we need to act about. And it's nice कि पुरुषों की भी बात सुनी जा रही है because many times we speak about women's health. And we welcome Swapna Jain ji from Vellore in Tamil Nadu. Bimla Kapoor madam है. And we welcome Dr. Neela Ramdas all the way from Trinidad and Tobago. ये सब लोग सुन रहे हैं हमें. Now, if our topic is obesity and men's health, then we need an expert who is able to handle endocrinology, men's health, and also talk about obesity. हमारे आज के स्पीकर हैं डॉक्टर जोएल टीलक्सिंग from Trinidad and Tobago. He'll be joining us shortly. So in advance, a warm welcome to Dr. Joel Teelucksingh. वो आते हैं तो उनको इंट्रोड्यूस करते हैं, but let's take our topic for today. Now, half of the people in the world are men. दुनिया में आधे लोग पुरुष हैं, and therefore half of the world's energy or human resource is also men. Therefore, we need to speak about men's health. And finally, somebody has joined the show जो कि पुरुष हैं. So welcome विनायक शर्मा. मैं बहुत lonely feel कर रहा था. So we now have Kanhaiya also with us. So welcome Vinayak. We'll talk about obesity and men's health, but पहले men's health की बात करते हैं. So जब बच्चा पैदा होता है, when a child is born, the child grows up, and when this boy grows up and goes through puberty, then sudden hormonal changes start. Hormones ऐसे आते हैं. You have from the brain hormones known as LH and FSH. They stimulate the testes. जो गोलियां हैं, they stimulate the testes to produce a hormone known as testosterone. And this testosterone leads to a lot of changes. It increases the size and strength of the genitals. It also leads to other changes like change in skin complexion, hair, and voice. So the boy grows up now into a strapping young man and he becomes fertile. He begins to produce sperm with which he can become a father. So now there are two aspects to men's health. One is sexuality and the other one is fertility. ये चीज चलती रहती है, and for many years this young boy who now becomes a young man and then a not so young man, a middle-aged man, he remains sexually active and fertile. In women, when menopause occurs, it occurs suddenly. तो महिलाओं में जब periods खत्म होते हैं तो अचानक ही खत्म होते हैं. So there is something that is known as menopause. In men, this doesn't happen suddenly. It happens slowly. धीरे-धीरे testosterone कम होता है, sexual ताकत कम होती है, and some people call it andropause. Others call it late onset hypogonadism. उसके बाद life continues, but the role of testosterone comes down. And because of that, and we welcome Ali Nazakat Sahab as well, because of that, fertility goes down, sexuality goes down, and also muscle strength, bone strength, they also go down. Not only that, as testosterone levels reduce, cardiovascular health also takes a toss. तो कार्डियोवैस्कुलर हेल्थ मतलब हार्ट की हेल्थ, खून की नसों की हेल्थ, ये भी कम हो जाती है विद लो टेस्टोस्टेरोन. So this is the natural history of any boy who is born. But where does obesity come in? अब obesity में कौन से hormones हैं जो बढ़ते हैं, कौन से हैं जो घटते हैं? Let's ask our expert, and we have Dr. Joel Teelucksingh, like I said. And Dr. Joel is a shy boy, so maybe we can see him on camera now. Warm welcome, Dr. Joel. Dr. Joel has been with us in the past और ये लॉग इन कर रहे हैं साउथ अमेरिका से, ट्रिनिडाड एंड टोबैगो से. तो अभी हाल ही में अभी पहुंचते हैं हमारे पास. सो नाउ व्हाट डज ओबेसिटी डू टू मेंस हेल्थ? We'll talk about that. Can obesity influence men's health? Can it influence our sexuality, fertility, and other diseases that men have? और चीजें जो आदमियों को होती हैं जैसे प्रोस्टेट की बीमारी, उसका इन्फ्लुएंस पड़ता है क्या ओबेसिटी का? वील फाइंड आउट. कैन मेंस हेल्थ इन्फ्लुएंस ओबेसिटी? किसी का टेस्टोस्टेरोन ज्यादा है, किसी का कम है. somebody has got hypogonadism, somebody has got high levels of testosterone. Will that influence weight? Will it influence the results of weight loss therapy? That also we need to find out. तो multiple चीजें हैं. So इसी के बारे में बात करेंगे. And this is the एंड्रो बैरोलॉजिकल एक्सिस. एक तरफ एंड्रो या टेस्टोस्टेरोन और एक तरफ बैरो या वेट. इनका देखते हैं मिश्रण क्या है. While we wait for Dr. Teelucksingh to join us, अब एक एक करके लेते हैं ये चीजें. जब वेट ज्यादा होता है ड्यूरिंग प्यूबर्टी तो मल्टीपल थिंग्स हैपन. नाउ वी आर टॉकिंग ओनली अबाउट बॉयज. शुरू में तो लड़के बड़े हट्टे कट्टे दिखते हैं. दे आर बिगर एंड दे आर टॉलर फॉर देयर एज. But if they remain heavy, if they don't lose weight, then the final adult height is reduced. तो अगर कोई बच्चा मोटा है, भारी है, शुरू में तो वो अपने बराबर वाले बच्चों के हिसाब से, लड़कों के हिसाब से बड़ा दिखाई देगा. He will look bigger than his peers. But when that puberty spurt comes, his colleagues will jump. They'll have that growth spurt. They will turn out to be taller than him. So uncontrolled obesity may reduce final adult height. पहले तो ये चीज होती है. दूसरा, puberty के टाइम पे self esteem is a major issue. So when you're changing, when the hormones are changing, then you want to look good, you want to look handsome. And if that doesn't happen, then the young boy may develop a psychological issue because of lack of self esteem. That converts into a social issue. And we welcome Sahisnu Bhatt Sahab from Gujarat. Warm welcome, Bhatt Sahab. So that develops into a social issue because you go out less. You start interacting less with the peers and especially with friends from the opposite sex. तो एक विशियस साइकिल शुरू होता है. अभिमन्यु वाला चक्रव्यूह स्टार्ट होता है. A vicious cycle or an अभिमन्यु का चक्रव्यूह starts where because of overweight or obesity, the boy becomes psychologically depressed, becomes socially inactive, goes out less for exercise and activity, and ends up becoming even more obese. So this kind of a vicious cycle can start during obesity, during puberty. Not only that, an obese child is more prone to bullying. And along with obesity, there is a term known as barophenotype. Barophenotype का मतलब है कि हमारी चर्बी कहाँ पे जमी हुई है. Are we overweight at the tummy level or at the hip level? तो एक कंडीशन है जिसका नाम है लाइपोमेस्टिया, एक और है गाइनेकोमेस्टिया. And we are still waiting for Dr. Joel Teelucksingh to join us. So lipomastia means जो breast area है वहाँ पे चर्बी जम जाती है, fat. Gynecomastia means breast tissue बन जाता है वहाँ पे. If this happens, then sometimes the boys are, bullied or teased, and that worsens this vicious cycle of pubertal obesity. Gynecomastia कहाँ से आया? So we talked of obesity starting off, kicking off a psychological and social cascade of ill-being, the opposite of well-being. What happens is that when testosterone goes out into the bloodstream एंड व्हेन इट गोज इनटू द एडिपोज टिश्यू, चर्बी में जाता है, एडिपोज टिश्यू में एक हार्मोन है जिसको, एक एंजाइम है जिसको बोलते हैं एरोमेटेज, एरोमाटेज. Aromatase breaks down the testosterone into female hormones, into estrogen. So if you are overweight, then no matter how much testosterone you have, all that is going to be broken down into estrogen. So as the female levels rise, the female hormone levels rise, you end up with gynecomastia or with that breast enlargement. So this is what happens at the level of puberty, at the time of puberty. Later on, what happens is obesity is an inflammatory state. ओबेसिटी एक सोजिश है, सूजन है, इट इज एन इन्फ्लेमेशन. जो एडिपोज सेल्स हैं, जो हमारी चर्बी है, उसकी कोशिकाओं से, फ्रॉम द सेल्स ऑफ द एडिपोज टिश्यू, मोटापे की कोशिकाओं से ऐसे हार्मोन्स निकलते हैं, सच हार्मोन्स आर ब्रॉट आउट, इनको एडिपोकाइंस कहा जाता है, एडिपोकाइंस. वी हैव गुड एडिपोकाइंस एंड बैड एडिपोकाइंस एज वेल. ये जो बैड एडिपोकाइंस हैं, दे आर प्रो इन्फ्लेमेटरी, एंटीऑक्सीडेंट, और ये बाकी बॉडी की सेहत और जवानी के खिलाफ काम करते हैं. इन आवर टेस्टिस वी प्रोड्यूस सेल्स नोन एज स्पर्म्स, स्पर्मेटोजोआ. ये जो स्पर्मेटोजोआ हैं, जो शुक्राणु हैं, ये बहुत ही चुस्त फुर्तीले सी कोशिकाएं हैं. दे आर वेरी फास्ट, वेरी रैपिड, वेरी नॉटी, बहुत चंचल. चंचल की इंग्लिश क्या है? चंचल इज नॉटी. So they are very naughty kind of cells because they have to move very fast. Their work is to fertilize the woman and to create a baby. If they are very fast and chust और फुर्तीले हैं, very fast and very active, then they need a lot of energy, isn't it? And they get their energy from an organelle known as the mitochondria. इनका जो माइटोकॉन्ड्रिया है या पावर हाउस है, वो बहुत स्ट्रांग है. अगर ओबेसिटी की वजह से ऐसे हार्मोन्स निकलते हैं या ऐसे केमिकल्स निकलते हैं जो माइटोकॉन्ड्रिया को दबा दें, फॉर एग्जाम्पल यू हैव ऑक्सीडेंट्स, तो फिर ये माइटोकॉन्ड्रिया काम नहीं करेंगे. सो इन ओबेसिटी व्हाट हैपेंस इज द नंबर ऑफ स्पर्म्स गोज डाउन, the quality of sperms, the motility of sperms also goes down. So that's another issue which happens. दूसरा, हमने वैसे ही बात की कि जो ओवरवेट लड़का होगा, आदमी होगा, पुरुष होगा, उनका फीमेल हार्मोन भी बढ़ रहा है because the testosterone is being broken down into estrogen. So when you have relatively low testosterone, the libido will come down. Sexual इच्छा कम हो जाएगी. So we've started from puberty. We see that puberty may be delayed and you may have a lesser final adult outcome. फिर psychological issues, social issues, lipomastia, gynecomastia may develop. And as the boy grows, and now we are thinking about sexuality and fertility instead of puberty, we see that sexuality will be impaired, libido comes down, and fertility will also be impaired. नॉट ओनली दैट, अगर कोई ओवरवेट हो तो बाकी चीजें भी आती हैं, मस्कुलोस्केलेटल इश्यूज. तो जो एंजॉयमेंट होता है हस्बैंड वाइफ का, उसमें भी कई बार कमी आ जाती है, अट्रैक्टिवनेस में भी कमी आती है. एंड देन दैट्स अनदर रीजन व्हाई यू गेट इनटू ट्रबल विद सोशल हेल्थ. अब सोशल हेल्थ की अगर बात करें, गड़बड़ तो होती है. अब जैसे डॉक्टर जोएल हमें ज्वाइन नहीं कर पा रहे आज, तो कभी कभी दिक्कत आती है. यू रीच आउट टू one person of the opposite gender, you say hi, good evening, how are you, and you want to build up a relationship. एक बार कोई मना कर दे, दो बार कोई मना कर दे, you are able to manage. अगर लगातार कोई मना करता जाए तो फिर दिक्कत आती है. एंड जो सेल्फ एस्टीम में पहले ही गड़बड़ थी with that obese boy, वो और वर्स हो जाता है. So these are some challenges that occur in young men with obesity. अब मान लो प्रेगनेंसी हो गई, तो जो जिस स्पर्म से प्रेगनेंसी हुई, दैट वाज अ बिट सब ऑप्टिमल. द स्ट्रेंथ, द मोटिलिटी, द क्वालिटी ऑफ द स्पर्म वाज सब ऑप्टिमल. सो द चांसेस ऑफ pregnancy loss are higher. And after a long time, we have Love Humanity on the talk show. So warm welcome, Love Humanity. It's good to be with you. Today we are talking about men's health and obesity. So we started our journey with puberty. We then went on to young men. We have talked about the impact of thank you, Love Humanity. अच्छा लगता है. Your eyes are beautiful. That's why you see everything as being beautiful. So you, अब मैं भूल गया मैं क्या कह रहा था. देखा ना, लव मेरे को confuse कर दिया. But when we talk of obesity, first we talk of the impact on puberty, then we talk of the impact on sexuality and on fertility. Along with that, we are repeatedly saying कि psychological and social health पे भी बहुत फर्क पड़ता है. एक और एस्पेक्ट है हेल्थ का, which is financial health, economic health. So if you want to buy, let's say, a 38 size shirt, it will cost 1,000 rupees. But you go and try to buy a 48 size shirt, एक तो मिलेगी नहीं पहले. You will not get that favorite color. मेरे वाला भी वो वाला नहीं मिलेगा जो लव ह्यूमैनिटी ढूंढ रहे हैं. So you may not get the color, the shirt, the shade that you want. And if you do, the cost is going to be more. So instead of 1,000, you might have to end up paying 1,600 rupees. And this occurs at each and every step of life. So for an obese gentleman, there's an economic price also that has to be paid. अभी तो मैंने सुना that in some countries and some airlines in the US, they now charge per body weight. So it's not that like you buy one ticket and it costs 10,000 rupees for everybody. They look at the weight, and if you are weighing over a particular sort of number, they'll charge you extra for sitting on the plane. So thank God that doesn't happen in India yet. KKG ने भी log in किया है. Good evening, sir. It's good to be with you. As we move on, so now we are talking of fertility, pregnancy होगी, but अगर obese sperm है, तो chances of pregnancy loss are higher. This we see in diabetes as well. Someone who has got uncontrolled diabetes, the father has uncontrolled diabetes, the chance of pregnancy loss and pregnancy complications will be higher. So these are other challenges that we face. And we have Dr. Joel back on board. Warm welcome, Dr. Teelucksingh.
Thank you very much. Thank you very much. Once more, I must say that it is an honor and a privilege to be a part of these MEDtalks. And thank you for continuing the dissemination of medical knowledge around the world, Dr. Kalra.
It's great to be with you. And let's reintroduce you to our friendly audience. Dr. Joel Teelucksingh is a consultant physician who specializes in endocrinology and diabetes. He works at the Central Specialist Medical Center and the Southwest Regional Health Authority in Trinidad and Tobago, affiliated with the Royal College of Physicians in the UK, and also pursuing an MPH course. He brings extensive international experience and knowledge to his practice. And he has reached out to people across continents through CMEs, through webinars conducted in Africa, in Asia, and in Europe, and of course his native South America. So warm welcome, sir.
Thank you very much. Pleasure and honor and privilege to be part of this webinar.
We were talking about men's health and obesity, Dr. Joel. So what is the prevalence of obesity that you see in men and women in Trinidad and Tobago?
That's a fascinating question, because I heard a bit of your preamble and you were speaking about how it really is an exploding pandemic. And perhaps when we think about the plethora of complications that would be associated with this scourge, it continues to be a battle, even in small island developing states like in the West Indies. And now the ethnic mix of Trinidad and Tobago is perhaps half in terms of Afro-Trinidadian, and half would be Indo-Trinidadian. And this is steeped in history because of the fact that the slave trade involved the Middle Passage in the 1700s, the 1600s and 1700s. And after slavery was abolished, they had to turn towards India for the laborers, but the indentured laborers. And half of the population would be Afro and half would be Indian. The prevalence of obesity in Trinidad and Tobago is perhaps about 25%. And we do see that more likely in the Indo-Trinidadian and like other parts of the world, actually in women, so the adult woman. Although what we've noticed is that childhood obesity has become a separate issue, similar to Western societies, and in that case, more boys than men. However, that does not mean that our men are slim and trim. In fact, per population, Trinidad and Tobago was rated in the top 10 countries in terms of the high prevalence of obesity.
So that means it is a major public health problem. But do the men of Trinidad and Tobago know that it's a major public health problem?
So it's interesting that you decided to talk about men's health for this month, because the month of November is a time in which we want to celebrate men. And as you know, November the 19th is International Men's Day. And sometimes, like other parts of the world, men tend to ignore their health. And they are often cajoled to go to see the doctor on the behest of a spouse or a relative, perhaps a sister or even their mother. So sometimes when they present to hospital, it's on the threshold of a catastrophic complication. Men don't like to go to the doctor. Maybe it's something that they remember in their past, in childhood, the size of the needle when they received a vaccine. So, and culturally, socio-culturally, men believe that they are taught that big boys don't cry, and similarly, big boys are not supposed to be affected by medical problems. Big boys are not supposed to even speak about some of these issues. So there's still a stigma amongst men that perhaps we are not diagnosing many of these chronic problems in time. When they present, it may be far too late. And at that stage, it leads to a longer stay in hospital, healthcare costs are increased, and of course, the mental and financial burden, if these men are the sole breadwinners, will be exacerbated. It's time for men, and the theme for International Men's Day on the 19th is actually positive male role models. Just as, but Dr. Sanjay Kalra is my role model. We need to have men as positive role models for healthcare in a family. We can't depend only on the matriarch to say that, okay, it's time to go for some sort of medical consult. Men must lead this. Men must lead this within their families to be healthy, happy, and holy.
Thank you. And Dr. Joel, a warm welcome to you from Dr. Bhalchandra Meshram, who says, welcome to India.
Love and blessings. Thank you very much.
And then there's another question. You said that 19th of November is International Men's Day. That's
Yes.
fine. Tell us about the history. Who started this event? Which great country started this event? Who started it, and how far has it spread its wings now?
We are very proud to say that International Men's Day was actually started by my brother, who lectures in history at the University of the West Indies. So he has a PhD in history, Dr. Jerome Teelucksingh, and it was started in the late 1990s. November 19th was chosen because it marked the birthday of our father. And we thought that he was such a positive role model and created that level of impact in our lives that we wanted to rejuvenate a day, not just to celebrate men, but also boys. There's actually a separate day now on May the 16th, which is the birthday of our mother, to have International Day of the Boy Child. There are groups within India, Asia, Latin and South America, North America, and Europe that continue to increase, and Australia, so across all the continents that continue to enhance not just knowledge, but also to spread the word about the importance of men and the value of positive role models on that family unit. So it was started in the late 1990s, and we're very proud to see the blossoming of International Men's Day. So on that specific day, please celebrate our men, our fathers, uncles, grandfathers. Celebrate, uplift, and enhance their mood and their value. That is something too, if I may mention, Dr. Kalra, that also remains in the shadows and perhaps is a separate pandemic. Although we often speak about the impact of chronic NCDs like obesity, diabetes, or hypertension in our men, the stigma remains for problems like depression and anxiety. And perhaps we will see that eventually as a separate entity and a separate component of the metabolic syndrome in the coming years. Because we talk about the NCDs like blood sugar, blood pressure, we talk about heart disease, we discuss the role of weight loss and diet. but sometimes we don't probe about those shadow pandemics of depression and anxiety. And these are underdiagnosed. They may be easy to treat and go hand in hand, in fact, with our theme of obesity and men's health because of the stigma attached sometimes to mental health.
So, like you said, big men are not supposed to cry. And then
Yes.
does that mean, if you extrapolate that, heavy men are not supposed to cry at all? Do you think that obese men have more than their fair share of anxiety, depression, distress? They feel afraid.
Wonderful question, because many of these men and women suffer in silence. And I think sometimes when it comes to increasing weight, there are genetic, cultural, socioeconomic determinants of why some persons may be battling with weight, sometimes hormonal. So there are physical, psychological, and cultural aspects when we're talking about problems with obesity. When we talk about men's health, very often we discuss the physical and sometimes the psychosexual aspects. And I will get back to some of these in time. These men have been stigmatized, sometimes bullied, harassed. They have been taunted, sometimes from childhood. We discussed the fact that in Trinidad and Tobago, we're battling the scourge of childhood obesity in boys. At one point, perhaps one child might have been struggling with his or her weight in a class. Now, if you look at a picture of a random school, a middle school or a junior school, you will see that perhaps half of the class is battling with this bulge around the tummy. And this is setting, of course, an issue. It's almost like a car crash in slow motion. It's going to create problems for the family and entire country. So it starts in childhood. There are stressors. There may be depression and anxiety in the teenage years. Of course, as hormones change, you start to become attracted to the opposite sex. That also becomes a problem. You feel socially isolated, problems sleeping, you're battling studies, hormonal changes, and sometimes taunts from your peers. There are issues with appetite. Your body image becomes distorted. We talk about bulimia, we talk about eating problems by anorexia in women and young girls, but that may be also under recognized in the male gender. Then these boys find that their academics suffer. They're less likely to become employed in a useful job. Sometimes now it's going to impact on their financial earning. So they're unable to afford healthy foods. So as they enter adulthood, they have to get calorie dense fast foods. Sometimes they might be working multiple jobs. They're unable to afford, as we said, foods that might be rich in nutrients or perhaps fruits, vegetables, nuts, pulses, and grains. It's easier to get fast foods. You're living alone, you're socially isolated, your financial status is dodgy, and then you're already battling weight. So those social determinants of health, which revolve around aspects like poverty, mental issues, depression and anxiety. You can't afford to go to a private doctor. So sometimes you're having erratic follow-ups. You're under recognizing the complications like diabetes and hypertension. It's almost like that slippery slope is expedited in persons who are within a lower socioeconomic bracket.
So that's a vicious cycle, and it's quite easy to enter it, but very difficult to come out of that. Is that right?
Indeed. And sometimes it has been said that one person within a family needs to break that cycle because this is going to continue for subsequent generations. Um, it's a multi-sectoral approach is required, whether we're looking at levels of the government sector, health, whether we're looking at the financial and economic sector, whether these individuals even have the will to change, because we know that the focus will be on different aspects. They just want to actually look at small targets rather than that watchword prevention, rather than looking at 30 years from now where we want our health sector to be, how we're going to deal with the scourge of obesity. They just want short-term answers. And unfortunately, the world has become like this, a fast-paced, technology riddled environment in which we want a quick fix, we want a magic bullet solution towards not just NCDs, but also the underlying factor of obesity, the driver. But as we know as physicians, sometimes these answers are not so straightforward or forthcoming.
तो डॉक्टर जोएल टीलक सिंह ने हमें बताया कि प्रॉब्लम क्या है ओबेसिटी की इतनी ज्यादा, और जैसे हम बात कर रहे थे अभिमन्यु वाले चक्रव्यूह की, घुसना तो बहुत आसान है, निकलना बहुत मुश्किल है. इट्स डिफिकल्ट टू कम आउट ऑफ दैट अभिमन्यु's पैराडॉक्स. एक तो साइकोलॉजिकल इश्यूज, साइकाइट्रिक इश्यूज. एक चीज जो डॉक्टर साहब ने बात नहीं की, दैट इज सब्सटेंस अब्यूज. आप डिप्रेशन में चल जाएं तो सब्सटेंस अब्यूज बढ़ता है. टोबैको, अल्कोहल, हार्ड ड्रग्स, इंट्रावीनस ड्रग्स. सोशल इश्यूज जैसे बुलिंग, और उसके बाद पूरी सोसाइटी बदल जाती है और इतने हम इम्यून हो जाते हैं, वी बिकम इम्यून टू द फैक्ट दैट देयर इज डिजीज विद इन अस. मगर डॉक्टर साहब ने हमें इलाज भी बताया है. सो ही हैज टोल्ड अस हाउ टू कम आउट ऑफ इट, एंड व्हाट ही सेज इज दैट एटलीस्ट वन मैन इन द फैमिली should come out of this vicious cycle. एक पुरुष अगर बाहर आ जाए तो बाकी सब भी निकल आएंगे, लड़के भी निकल आएंगे. If one gentleman comes out, the other boys will also come out of it. और यही तो 19 नवंबर को जो इंटरनेशनल मेंस डे है, उसकी थीम है, उसकी मुहिम है. And Dr. Joel, would you repeat the theme again for this year's men's
The
day?
The theme for International Men's Day on the 19th of November is positive role models. So we're actually trying to engage more men, and once more, a role model within the family, as you mentioned, that must be able to rise like a phoenix from the ashes. And that is going to set in motion positives for not just that family, that village, that community, that school, that workplace, and indeed the country as a whole.
सो पॉजिटिव रोल मॉडल चाहिए, ये डॉक्टर साहब कह रहे हैं. हमने प्रॉब्लम स्टेटमेंट अपनी सेट की, ओबेसिटी एंड मेंस हेल्थ, और उसका डॉक्टर साहब इतना सरल जवाब दे रहे हैं, सच ए सिंपल आंसर. एक सकारात्मक सोच, दैट इज अ पॉजिटिव थॉट प्रोसेस, अ पॉजिटिव अप्रोच, और सकारात्मक रोल मॉडल. एक पुरुष चाहिए जो खड़ा हो सके और ओबेसिटी से निकले. So now, Dr. Joel, is that easy to do? I struggle with obesity. Sometimes I win, sometimes I lose. Am I a positive role model for other people who live with obesity? Right now, my BMI is nowhere near optimal.
Yes, and I think that sometimes we don't practice what we preach, but bearing in mind that when we're speaking about weight, it should not be looked in isolation. We're also looking at your level of fitness. So I've seen some of your videos at a recently concluded Endocrine Society of India conference, and you were certainly far fitter than most of the Trinbagonians, as you did your dances, as you did some of the opening parts of the ceremony. So that battle continues because sometimes the metabolism is different. We know that we mentioned about genetic factors, socio-cultural. Sometimes we see hidden factors like stress or lack of sleep, hormonal entities. There may be medications that may be impacting on weight. However, we know that we live in a westernized society that tends to substitute machines for muscles and substitutes calorie-dense processed foods for foods that we used to eat from the 1950s and 60s. Unrefined fruits, vegetables, peas and beans, low fat and low salt. So it's time to return to a simpler era in India, a simpler time in Asia or the West Indies, in which we move away from the ultra processed foods that we discuss, the foods high in sugar, salt, and saturated fat, and pay attention to those hidden aspects of our lifestyles. Now, you are slim and trim, although you do say that you battle. Perhaps the body mass index is not the only measure that we would look at. And I know that you've written extensively about some of the other markers ranging from waist circumference and sometimes even some of the other measures that we look at, because there is an entity called sarcopenic obesity that has become quite popular in the medical literature. Sarcopenia, and sarco is the Greek word for flesh and penia meaning loss. And sarcopenic obesity refers to some persons as they're growing older with a loss of muscle mass or muscle weakness, but may have accompanying increasing weight around the tummy. And those persons may be at an even higher risk for some of the complications like diabetes or cardiovascular disease. So there are some people who may think that they are small in frame, their arms and legs are small, but they're actually battling sarcopenic obesity and at higher risk for complications. Some persons like you may find that they should be a bit better in terms of body size or habitus, but they may be extremely fit. They may have a high level of cardiovascular fitness. And of course, when you do your blood tests, you may find that you don't have entities with a metabolic syndrome. There is even a term that has been introduced called metabolically healthy obesity. That seems like a paradox. Whether or not it is true, some doctors would say that it is just a red flag that you must be careful. It doesn't mean that all is well, and in the future there may be problems brewing. So the struggle continues, and it is a real one. I want to compliment you and applaud for someone who not just maintains that thrust in increasing education in the fraternity and for the public, but also someone who continues to live a healthy lifestyle, to continue with his healthy eating, your diet. You mentioned about stopping smoking and limiting alcohol in our patients, and of course, avoiding some of those harder drugs that may increase the risk for complications, avoiding stress, getting enough sleep, and of course, having a holistic approach to life, mindfulness, and being mindful about health. And I think that is something that our men um, are not aware of. Being more mindful, focusing on not just the physical aspects, not just being part of the rat race and bringing home a salary to our families, but also mindfulness, being aware of your body, your soul, and your spirit.
That's great, Dr. Joel, and thanks for that. And you are right, you have to keep on trying. So this is what we learn from the Bhagavad Gita as well. डॉक्टर साहब ने कहा कि आप कोशिश करते रहें, एक हेल्दी या सेहतमंद लाइफस्टाइल या दिनचर्या बिताएं और साथ में एक सेहतमंद माइंड स्टाइल. तो देखो, एक अंग्रेजी का शब्द है लाइफस्टाइल, दूसरा शब्द है माइंड स्टाइल. So, Dr. Joel, if you were to use the word mindset, a very static kind of a very stubborn, कोई खड़ूस सड़ियल सा तरीका, that's what mindset means. हम इसको बदल नहीं सकते, we cannot change. But then, so Dr. Joel, the word mindset versus the concept of mind style, what kind of differences come to your mind, and do you think we can change, influence our mind style ourselves? Where do we get that role model from?
That's a lovely term, mind style, because it brings to my mind, no pun intended, it brings to my mind about adopting a lifestyle that will be beneficial not just for physical, but also for the psychosocial, for the cultural, for the family. A mind style is something that will be inculcated within the brain, but it's going to accrue benefits to the entire body, including the spirit and soul. So that healthy mind style, something that becomes a part of your life. It becomes something that is almost like a reflex. When you're reaching for something to eat, you're not looking for a snack that will be high in salt or sugar or a fat. You're reaching for something that will be healthy. You're focusing on small stages. Perhaps if you want to embark on a lifestyle change such as exercise, you're thinking about perhaps a walk for 15 minutes. You're thinking about parking a little bit away because your mind is guiding you. You're parking a little bit away from work or from the supermarket, so you can walk a bit briskly into work or while shopping. You're thinking as well too, as part of your mind style, you're thinking about increasing that amount of exercise, those little accruements, perhaps from 15 to 20 minutes to 25. You're walking, running, biking, jogging, or in your case, doing Zumba, Dr. Kalra. So You're thinking as well too about the great outdoors. You're starting to look outside. You're saying a prayer as you walk. You're thinking about inhaling the fresh air in some parts. Well, I hope the air is fresh where you live. You're thinking about now in terms of avoiding stress, how you respond to a situation, perhaps at work or at school. You encountered a co-worker or your boss that was increasing your stress level. But as a man, we have been taught in childhood that we must be aggressive. We must respond in like. We don't want to have any signs of weakness. But your mind style now is going to make sure that you do breathing exercises, perhaps. You are going to respond in a different way, a constructive way. Perhaps the criticism that you received will be done, that you will enhance your response in the future, that you can learn from this. And it's a learning experience in everyone whom you meet. So the mind style involves inculcating small changes so that it becomes part of your life. It becomes part of the lifestyle. And you're not going to be set in your ways that may have been something you learned at home. As a child, you looked at your parents. And unfortunately, sometimes these habits were not the best. And it has been said, it has been said that many of your life experiences that were negative almost set the tone as you grow into adulthood. But this is where we break the cycle. This is where you break your mindset and you're not set in your ways anymore. You become more stylish. You adopt a mind style that is going to create positive health benefits. It's going to make you a better person. It's going to make you someone that people want to be around, people want to engage, and it is going to be something that will benefit the entire country and indeed the world. You're going to spread that love that can be changed. So we are no longer set in our ways. Our mindset is going to be altered towards mind style. I love that expression because it is going to be something that can be molded. We can mold our children. We can mold, and I'm I am going to say this again. This is where positive role models begin. They begin at the home, they begin at the school. Many of our viewers and listeners would have teachers and principals that set a lifestyle for them that was better than their home environment. Perhaps they came from abusive settings there at home or school, and you don't want that curse. That generational curse is going to be broken so that you don't want to pass that on to your friends or family.
तो ये जो डॉक्टर साहब हमें कह रहे हैं वो कह रहे हैं सकारात्मक रोल मॉडल, सकारात्मक प्रेरणा ये हम लाएं। और कैसे लाएंगे? हाउ विल वी ब्रिंग पॉजिटिव रोल मॉडल इनटू वर्क? पहले तो सकारात्मक सोच, थिंक पॉजिटिव, दैट्स व्हाट अ माइंड स्टाइल इज, अ पॉजिटिव माइंड स्टाइल। सकारात्मक अल्फाज या शब्दावली, स्पीक पॉजिटिव, एंड उसके बाद ऑटोमेटिकली पॉजिटिव एक्शंस आ जाएंगी। एंड पॉजिटिव एक्शंस डोंट हैव टू बी वेरी बिग। ऐसा नहीं कि आप सीधा ही जाके ओलंपिक्स में गोल्ड मेडल लाने की कोशिश करें कुश्ती में। डोंट गो एंड ट्राई फॉर अ रेसलिंग गोल्ड मेडल ऑन डे वन। स्मॉल थिंग्स लाइक चेंजिंग द वे यू वॉक एंड द वे यू वर्क। पिछली जनरेशन का लोग बोलते हैं, डॉक्टर साहब ने भी इसका जिक्र किया कि पहले हो सकता है एक्टिविटीज या बिहेवियर सही नहीं थे, बट डोंट लुक एट देम इन आइसोलेशन। अगर आप ये कहते हैं कि पिछली पीढ़ी, प्रीवियस जनरेशन घी खाती थी 1-1 किलो रोज, सो दे यूज्ड टू ड्रिंक और ईट, इन राजस्थान दे एक्चुअली ड्रिंक घी, they don't eat it. They used to drink, let us say, 500 grams of ghee every day. That is fine, but also remember that they used to walk 10 kilometers a day. तो ये अब कहाँ की सच्चाई है, या ये कहाँ से जायज कहेंगे कि जी घी तो हम खाते रहेंगे, we will keep on eating the ghee, but we will not walk. Even if we have to travel half a kilometer, we will do that in a car. So you have to take everything from the previous generation. You cannot pick and choose and take as per convenience. We have a best practice, Dr. Joel, and we have IMDX expert logged in with us, a 47-year young gentleman who has started semaglutide and has now lost 2 kg. He has also started home gym, so very well done. That is called role model. He has stopped junk food. So both positive and negative actions. Positive, started the home gym. Negative, stopped the junk food, and he has replaced the junk food with vegetables and fruits. So see all these things, and he has been able to lose 2 kg, which is great. Any
Marvelous.
suggestions? Yeah. Any suggestions for our 47-year young gentleman?
Yes. So that is a marvelous start towards healthy lifestyles. And a watchword, as we said, prevention. And well, I'm assuming too that he has ensured that certain aspects of his health would be modified. He's been going in baby steps. He started exercising. He has amended his diet. Also, he needs to pay attention to factors. Well, I'm not sure if he's a smoker, so if he drinks, but once more, we mentioned that these may be some lifestyle changes that could be altered. What about sleep? Please ensure that he's having enough sleep because these are changes which alter our hormones and indeed our entire metabolism. His stress needs to also be addressed, whether at a home or at work settings. And one of the points, though, that we mention is the value for screening in certain basic investigations. He may want to consider doing his blood pressure, his blood sugar, ensuring that his lipids may be monitored because these are silent killers. Sometimes we don't pay attention to the fact that asymptomatic chronic problems may present with catastrophic complications, so the value for screening cannot be underemphasized, especially if he has a family history of these medical problems. Sometimes patients may consider if they're having subtle issues, perhaps with their heart. The Southeast Asian phenotype may find that they may be at an increased risk for heart disease. Um, at a younger age and with a lower body mass index. So he may want to talk with the primary care physician about certain changes and certain investigations that would be warranted. So stress, lack of sleep, paying attention to some of our lifestyle habits and the value for screening, and he continues along that perfect pathway towards a healthy lifestyle. The use of semaglutide has gained popularity. In places like the West Indies, it's still limited because of cost, but certainly the studies which have been emanating from the United States and Europe have been very positive, particularly in patients perhaps with macrovascular complications and even with renal disease.
So that's a great point, and thanks, I am DM expert. We are inspired by you. तो बात ही यही हो रही थी रोल मॉडल की, and आप हमारे रोल मॉडल बन गए आज के.
Thank you.
He has
Yes,
also identified his challenges, so he needs to work on his sleep and improve his sleep hygiene, which also influences obesity and weight gain. And he is doing a regular checkup now, so he has become serious about his health. Just a
many
question,
problems.
Dr. Joy. Yeah, in a in a single sentence, is 47 young or is it not so young?
You are as young as you feel. So I think that 47 years very young now. So in one sentence, 47 is the new 27. Think of it like that. You're young, fit well, and it's just a matter to be vigilant. We must be careful. We all are about that age, well, except for Dr. Calories. He stopped checking after 21, so he isn't sure about his age. But he said it looks like 21 now. But perhaps we must be careful. And bearing in mind, too, if I may reiterate, the Southeast Asian must be careful from our 30s and 40s. We've seen it in the West Indies, and perhaps it has become more so since COVID-19. For the last 4 years, we've been seeing many of our patients, 30s and 40s, battling some of the aspects of the metabolic syndrome, whether it was linked to the virus or linked with our lifestyles wrought upon from the pandemic is unclear, or some may argue the vaccine. We won't go there. But 30s and 40s, still young, healthy, fit, and vibrant. But we must still be careful about the complications. We're seeing them at earlier ages, and the metabolic syndrome is no exception.
And that's the way I think we should all think. That is what a positive mind style means. And that's what big men are supposed to do. They are supposed to take challenges head on. तो यदि आपका challenge है obesity, तो उस challenge से लड़ाई करें. You fight the challenge. बिल्ली जैसे बिल में छुपने का क्या फायदा है? There's no point in going and hiding underground in your den. You need to come out and fight, and that's what we see our role models doing, following a healthy lifestyle, taking the help of their doctors, their healthcare team, and moving towards a healthier and a younger future. ये जो दवाइयां हैं जैसे IMDM एक्सपर्ट यूज कर रहे हैं सेमाग्लुटाइड, इनके साथ ये भी रिसर्च हुई है कि आपकी उम्र बढ़ती है क्योंकि आपके हार्ट और किडनी, योर हार्ट, किडनी, लिवर, दे बिकम यंगर, ये ज्यादा जवान होते हैं. तो इट्स नॉट जस्ट अबाउट बीइंग 47 years old as per the calendar chronological age. It's about how young your heart is, how young your liver and kidneys are, so they actually become younger. It's been an hour nearly, Dr. Joel, and we have Arpita with us backstage. Arpita and her team, they look after us, they look after KK Med Talks, and they make sure that we're able to connect with colleagues and friends from across the world. So,
Marvelous.
Arpita, yeah, anything new that you've learned from today's webinar?
Yeah. One of the things, though, that I read in the past week has been an excellent paper or an excellent article by your goodly self and colleagues on a phenomenon that you have proposed called obesity associated reproductive and sexual syndrome. And I think you had an excellent discourse at the start of the webinar in terms of the link in men in particular with increasing body weight, sexual dysfunction, and reproductive abnormalities. OARS, that by the acronym OARS. So, and I think it would be useful to just bring that point out to our viewers and listeners that there is a strong association with obesity, and that association, OARS, with reproductive and sexual abnormalities, may be under-recognized, stigmatized, and many men may hesitate to mention as part of a clinical consultation. And sometimes we need to discuss it. The bigger point for me, too, is that something simple like erectile dysfunction may be a harbinger for cardiovascular disease. It is a dipstick for having a heart attack or stroke. Sometimes there may be psychological issues, there may be physical reasons, sometimes medication-induced hormonal abnormalities, but it warrants further investigation. So it remains once more a symptom in the shadows and sometimes locked within the bed sheets. That must be something we bring to the forefront too as clinicians and as doctors. Sometimes asking a pointed question about erectile dysfunction may yield benefits as part of a reasoned encounter. So I was fascinated by that acronym, and thank you for bringing that in the Journal of the Pakistan Medical Association, OARS, and worthwhile bringing very much into the world's medical literature. Thank you very much for having me once more. So it is an honor and a privilege. I would love to be a part of these Med Talks in the future. Love and blessings. Happy International Men's Day to you and indeed the rest of our team. And let us remember that positive role models, whether men or women, are the way forward for our world.
We have great news from the IMDX expert household. So after 25 years of happy marriage, 20 years, so IMDM expert began losing weight. He has become a role model. He says for the first time in his married life, his wife has started listening to him. She has also started eating healthy food. So that's another advantage. And that is a great, great achievement, IMDM expert. I mean,
It is
that's an
the
achievement
first time his wife has listened.
very few men can claim to have. But सबको मिलके बहुत अच्छा लगा, and it's fun talking about such topics और बात करनी चाहिए. Like Dr. Joel said, we should take them out of the bed sheets, out of the bedroom, and we should bring them into public discourse. बात नहीं करेंगे तो ठीक कैसे करेंगे? If we don't speak, if we don't listen, how will we address? How will we correct? तो बात तो करनी बनती है. और ये तो शुरुआत है. We'll keep on talking every Monday on Obesity Med Talks about various aspects of obesity related health. इसके साथ अर्पिता, do we have IMD expert is healthy? और अब तो पड़ोसना भी सुनना शुरू कर देंगे IMD expert. अब तो now the neighbors are also going to listen to him, so you will find the entire neighborhood following him.
This is how you lead. This is how you inculcate community spirit.
Yeah. So you lead the community as well, and we are happy. Shashi Mehta ji भी thank you कर रहे हैं आपको. Arpita, do we have a certificate of appreciation for Dr. Joel, please? सबको शुक्रिया. Thank you so much, Arpita. सबको शुक्रिया, धन्यवाद, मेहरबानी. Thank you, Dr. Joel.
Thank
In
you.
in Haryanvi, which is my state language, Thara bhala ho. May all be good with you.
You're
Sabka
more
bhala
good.
ho. May all be good for everyone.
Love and blessings.
Jai Trinidad and Tobago. Jai Hind.
Jai Hind. Namaskar. Thank you.